I wanted to become a physician because I really like the science of how the body works, and I really like helping people solve their problems. And in case of rheumatology, help them get back to work, get back to taking care of their kids or hobbies, whatever they couldn't do before arthritis or other kind of pains. When I was going through high school and college, I thought about my own pediatrician and how he was just a terrific guy and took care of us really well. So that was, I think, a good symbol of what I thought a doctor could be. People overcoming their arthritis is something that it gets me out of bed every morning and brings me to work here at ARA. And my patients that I've taken care of here who've reported back that now they can get back on their bike, or they're back in school, back taking care of their kids at work, etc. That's always what kind of motivates me. It's really gratifying. Sprinkled through the typical office day, and then when I'm out of the office, I'm working just about every day on political advocacy. So advocacy around healthcare issues, getting people better access to treatments, access to a physician. Right now I'm working as the chair of government affairs for the American College of Rheumatology. And it's a lot of fun. It's very exciting, working with the federal government, both the Capitol Hill, the legislative branch, and the agencies that take care of Medicare and Food and Drug Administration, to try to make rheumatology easier to practice, better for our patients, and give them more access to the treatments that we've got to offer. I do like to write. I have a blog that on the ARA's website, and I try every month or so to give people who read it an update on what's going on in Washington. Some of the things they can read in the paper, but also that they might not get from typical news articles about healthcare reform, about changing prescription medications and insurance, things like that. I had an experience when I was in my training, fellowship training at the Veterans Hospital here in DC, that I still remember to this day, because it was the day that I learned how to do a cortisone shot in the ankle joint. And my senior fellow was teaching me where to put the needle and how to extract fluid and put medicine in. And we had wheeled a gentleman back from the emergency room into the rheumatology clinic because he couldn't walk. He was having a gout flare in his ankle. And I still remember the moment that right after I finished doing the procedure, but not only was I done for the first time injecting an ankle joint, but the guy rose up out of the wheelchair and walked out of the hospital. And so to go from not being able to walk at all to going home on his own, walking on his own 2 feet, it was pretty dramatic.